Hello, we are Canyon del Oro Hosa. I'm Bailey Morris.
I'm Kimora Heron.
I'm Anthony Jimenez.
And I'm Chantal Newhouse. And our topic is the effect on mental health due to drastic life changes. Please take a moment and answer some quick questions from our survey.
Throughout our experience as high school students, we have both witnessed mental health struggles within our peers as well as experienced these struggles within ourselves. Worldwide, more than 70% of young people who struggle with their mental health do not receive treatment. Teenagers especially often face difficulty getting help due to many different factors such as stigmas, lack of knowledge, shame or embarrassment, and limited access to resources. Mental health is an extremely important topic, especially in teenagers, as it may impact their development, relationships, and well-being. Maintaining good mental health is extremely beneficial in adolescence as it forms the foundation for a healthy mind in adulthood. Our goal is to educate and bring awareness to these different mental health disorders, as well as explain what they are, how they develop, and how to treat them. We hope to encourage others to not feel ashamed and to speak out for themselves and others and to make a difference. Specifically in this presentation, we will explore how mental health disorders develop from drastic life changes. Drastic life changes in adolescence, such as significant family transitions, academic difficulties, or exposure to trauma, can significantly influence the development of mental health disorders like anxiety and depression. These changes can trigger and exacerbate existing vulnerability, impacting brain development and overall mental health well-being. Changes in hormonal and hormonal receptors, powerful emotional responses to social stimuli, and rapid alterations in motivation and the brain's reward system may underlie the onset of anxiety, eating disorders, ADHD, and depressive disorders. During adolescence is an extremely unique and formative time. Physical, emotional, and social changes, abuse, or violence can make adolescents vulnerable to mental health disorders. Suicide is the third leading cause of death among those aged 15 to 29-year-old. The consequences of failing to address adolescents' mental health conditions extend to adulthood, impairing both physical and mental health, as well as limiting opportunities to lead fulfilling lives as adults.
Firstly, how may anxiety result from drastic life changes during adolescence? Anxiety disorders are extremely common during adolescence as teenagers go through various impactful changes in their lives. These may include social aspects such as family and peer relationships, exposure to social media, transitions in school like middle school to high school or high school to university, academic pressures, and of course, hormonal changes. Anxiety disorders may cause things like social withdrawal, faltering grades, recurrent fears about things you're not normally anxious about, and unfortunately, substance abuse. The most common symptoms of anxiety disorders include excessive worry about things you're not normally anxious about, issues with focusing and sleeping, getting easily upset or agitated, and physical effects as well, like headaches and stomach aches. There are two kinds of treatments for anxiety disorders, such as psychotherapy like CBT, which is cognitive behavioral therapy, created by this guy over here, Aaron Beck. You have exposure therapy, ACT, which is acceptance commitment therapy, and also interpersonal therapy. There are also medications that people with anxiety disorders take, such as antidepressants, which unfortunately may lead to substance abuse. But how have life changes led to anxiety? There are stress factors like relationship dynamics and academic pressures, which increase levels of cortisol and adrenaline, both of which trigger the body's fight or flight response, causing abnormal levels of anxiety. There are also biological factors such as additional hormonal changes and genetic predispositions. Over 100 genes have been found to be associated with anxiety, insinuating that anxiety disorders may be genetically predisposed. Hormonal changes are prevalent in adolescence, which lead to abnormal changes of serotonin, estrogen, testosterone, and thyroid hormones. So here are some statistics about anxiety disorders. 32%, or about 1 in 3 adolescents, have an anxiety disorder. Additionally, only 20% of diagnosable adolescents receive treatment for anxiety, while 80% do not.
Now we are going to talk about depression. How may drastic life changes lead to depression? Drastic life changes experienced by adolescents, in addition to the vulnerability of this developmental stage in their life, can increase their risk for depression. These changes include biological and hormonal changes, such as puberty and brain development, as well as psychological and social factors, such as stress, social pressures, and family or relationship changes. The stresses of these big life changes can trigger the onset of depression as well as many other mental health disorders. Low serotonin levels, which have been linked to depression, are very commonly caused by significant stress due to drastic life changes. Similarly, stress caused by big life changes has been linked to decreased dopamine levels, which can disrupt the brain reward system. What are the signs and symptoms of depression? Depression can manifest in many ways, both emotionally and physically. The most common signs of depression are persistent sadness, loss of interest in activities which the individual previously enjoyed, sleep disturbances, changes in appetite either over or under eating, irritation, behavioral changes, social withdrawal, and in some severe cases, thoughts of death or suicide. What are the effects of depression on adolescents? Some effects which depression may have include academic difficulties, strained relationships, decreased energy levels, and a negative self-image. Some individuals may also experience physical effects such as aches, pains, or digestive issues. Treatments for adolescents include forms of psychotherapy such as cognitive behavioral therapy as well as interpersonal therapy and family therapy, which can help the teen individuals develop coping skills to address underlying issues contributing to their depression. Medications may also be considered in some severe cases, however, they require careful monitoring. Something important to address in adolescence is substance abuse. Many teens suffering from depression may seek relief from their negative emotions by self-medicating or through the abuse of drugs or alcohol. This is caused by a bodily response called negative urgency. Negative urgency is a tendency in some individuals to act impulsively and irresponsibly in response to negative emotions. Drugs and alcohol may provide temporary relief from feelings of sadness or hopelessness, however, relief is short-lived and may worsen underlying depression long-term. It is extremely important to note that early intervention is crucial in preventing these symptoms from worsening, as well as providing teenagers with open communication and support from those around them. Encourage healthy habits such as exercise and balanced diets, as well as ask assistance in school or other aspects if needed. Now, let's look at some statistics involving depression. Nearly 20% or 1 in 5 teenagers have experienced depression in some severity by the age of 17, and about 15% of those individuals have experienced a major depressive episode. And an estimated 30 to 50% of teenagers struggling with their mental health have turned to substance abuse.
How may ADHD result from drastic life changes during adolescence? The background: ADHD stands for Attention Deficit Hyperactivity Disorder, and is developed from youth to adolescence and is typically associated with attention and behavioral problems. The effects are they're very chronic and long-lasting, and they can impair functions, and it can really cause a person to fall behind in school, work, and social aspects. The treatment is physiotherapy or medications such as stimulants and non-stimulants. How have drastic life changes led to ADHD? A lot rely on genetic and environmental factors, especially during pregnancy, that can lead to the disorder. 11.3% of children and adolescents have been diagnosed with ADHD. There is a link to substance abuse. Several studies show strong connections between ADHD, substance abuse, and alcoholism. Treatments for substance abuse and alcoholism has a 25% chance of relating to the disorder. Alcohol abuse also has 14% relating to the disorder, and there have been strong links to marijuana and other recreational drug use between ADHD. It has become a problem. There are signs such as forgetfulness, carelessness, risky behavior, trouble getting along, disorganization, excessive talking, difficulty sitting still, and daydreaming. And this ADHD iceberg shows that it's not always what it seems.
Next up, we're going to be looking at body dysmorphia disorder, BDD, and eating disorders, ED, and we're going to be looking at these mental illnesses and how they result from drastic life changes in adolescence. Some background knowledge to start with is that these mental illnesses are comorbid to each other because they are both mental illnesses caused in the early ages of adolescence. Some effects of these mental illnesses together include severe psychological effects to one's self-image. Adolescents will begin to lose self-esteem because of failure about their appearance. And lastly, they will begin to dissociate themselves from social interactions because of disgust about their self-image. Some treatments with these mental illnesses include cognitive behavioral therapy, CBT, serotonin reuptake inhibitors, SRIs, psychotherapy, and nutrition education for the adolescent. Now, how may this result? Well, life changes cause a chemical imbalance in the adolescent in which the adolescent may not be able to handle all of the hormones going throughout their nervous system. Some signs indicating about these mental illnesses include the adolescent may begin to excessively look at the mirror or avoid mirrors altogether. The adolescent will target one aspect of their body. They will begin to compare themselves to others. They will go to a great extent to conceal their flaws, excessively exercise, eat or purge, look for reassurance in others about their image. They will begin to develop perfectionist tendencies, and lastly, they will begin to experience depression symptoms because of their failure about their self-image. Lastly, some graphical analysis to note the age onset for BDD, and noting that the highest percentage of BDD occurring is in 11 to 15-year-olds, with the highest percentage being 40%. And secondly, looking at 32.5% with those with BDD have an ED as well. And then substance abuse, those with BDD develop substance use disorders, and this aggravates their brain activity. This makes it harder for the adolescent to recover from both these mental illnesses. And according to the Recovery Village, about half of those with the disorder have had a substance disorder at some point in their life.
How will this presentation apply to our healthcare careers? Chantal Newhouse said she will be able to apply this info to her everyday life by helping others around her and raising awareness about mental health, its factors, and its potential effects. H.A. Jimenez said that this presentation will help him use his newfound knowledge of mental health while going into a career of nursing by being able to talk with his patients and understand what they are going through. Bailey Morris said she will work with athletes who will experience mental health, and she will be able to find ways to inform them about factors, effects, and treatments. Kamora Heron said that this presentation will help her in understanding the complex emotions her clients may be feeling due to a drastic life change involving the health of their pet companion.
Furthermore, we'd like to give some resources. These may require you to text, call, or email. Lastly, use the resources closest to you. Let it be therapists, primary care providers, or counseling services provided in school or workplace. If you feel like giving up, don't. Remember, you are not alone. In closing,
I'm Bailey Morris.
I'm Kamora Heron.
I'm Chantal Newhouse.
and I'm Anthony Jimenez. And remember, it's great to be a Dorado.